Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hey everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet, and today I'm talking to retired paediatrician, paediatric dentist, Dr. Lee Weinstein, who now lives in Scottsdale, Arizona, but has had a long career in paediatric dentistry from the East Coast, from Philadelphia to New Jersey to Long Island, and then to Arizona. Lee, welcome to the Ultimate Dental Podcast.
Thanks for having me, Dr. Moffet. I appreciate it. I think we
can. Look, Lee, as I was saying before, you know, my friends call me David. You can call me David, all right? So no need to call me...
All right, that's fine. You can call me...
No need to call me Dr. Moffet, but I appreciate the formality. I used to ask my patients to call me Dr. Moffet when I was young because it made me feel like I was older. But right. Once I got into my 40s, it was like, who's Dr. Moffet? You know, is there somebody else in the room? I just wanted...
My patients always call me Dr. Lee. We can walk in the mall, and people will still say, Dr. Lee, and they'll wave hello. So I keep that as a term of affection and nicety. And so
now, Lee, that might be because they don't know how to say your last name, because it could be Weinstein or Weinstein, just depending on whether you're a beer drinker or a wine drinker.
Well, I drink both.
And as long as you spell your name right, then I used to say, if you expect me to pay your bill, spell my name right. And,
or as my grandpa said, you can call me anything you want, but just don't call me late for dinner. So that was
the joys of names. Even though I once was at a hotel and a woman spelt her surname when she was ordering a drink at the poolside bar, and her surname was Lewis, and she went Lewis, and I thought, well, down here that's the only way to spell Lewis. There is no other way.
Right.
But maybe some people spelled it Louis.
Right.
Anyway, Lee, you've had a long, despite the fact that you're such a young-looking man, you've had a long career in pediatric dentistry. What initially drew you into pediatrics?
I think I kept eliminating every possibility from all the other projects in school. I didn't like doing dentures. I didn't like doing some prosthetics. I really did it because I like kids. And you know what? You have to do what your passion tells you to do. And kids are great. 99% of the kids that we work on are great. 1% are not. And, the 1% are bad no matter what you do. But they come back and they give you unconditional love, easier to work with, and just fun. I can get on the floor. I can behave like an idiot. I justify why I go to see that new Disney movie at the movie theater and have fun doing it. My wife teaches nursery school, so we're like Mr. and Mrs. Rogers, sometimes with 4-letter words because that's the way we behave. But nevertheless, kids are just fun. And if you're not doing kids in your office, try it. Have fun and don't pretend you're much more sophisticated than you already are. That's just get on that level and have a good time.
Gee, you just got me in the heart there, Lee. My practice was in a central business district and in a rough part of Sydney. And I used to say that if you brought your children into that part of the city, it was literally child abuse because it was traumatic for them to see, what was going on in the streets. And so I had a practice that was very predictable because children can be unpredictable. How did you get around that in treating children?
Well, that comes in a whole bunch of phases. One, obviously, is our training. Two, it's our disposition. Three, it's my staff. Four, it's front staff, back staff. We meet, we have fun, and you hire the right people. And at the same time, it is hard, but we understand what our issues are, and with team meetings and with approach to the right attitude, you're going to have fun. And if you're not going to have fun, I don't want you working for me. And that's okay. Yeah, we're going to work, and we work hard. And when we do IV sedations, or we do regular sedations, or we have a tough kid, we're going to work, and we're going to work hard, but we're going to also have some fun at the same time. And we don't take things that seriously. It's a totally different world than doing adults in a general practice, and whether you're doing implants or dentures or whatever you're doing. You need to be more serious. We don't need to be more serious. We do better when we're not more serious. People would come to our office, and the first thing they say when they come in is, "Well, we're here for Michael's teeth." And I said, "Well, I figured that. I mean, I understand. That's why would you come to me if you didn't want me to take care of his teeth? But before we get to his teeth, why don't you tell me about yourself? Why don't you tell me where you're from? What do you do? How long you've lived here, what your experience are, and all of that stuff. So we know how to treat you and your kids." And all our staff was trained to do that. And whether we did special needs kids or we did regular kids, normal kids, abnormal kids, whatever it is, we treated everybody the same. Whether you were on Medicaid, you paid by insurance, you paid by cash, it didn't make a difference. Everybody was treated the same and equally. And everybody that I worked with either had their own kids or had a lot of nieces and nephews and could work together. My staff stayed together for 30 years. I just got off the phone yesterday with my old office manager back in New York, and we're still friendly. And her husband, she just turned 70, and we laugh and we go right back to where we started. So it's a matter of training and doing that. And kids, yeah, they can be tough, but they can be also fun. They'll cry, and 2 seconds after they finish crying and they get the sticker, they're smiling and they're on their way out.
You raise a really good point there, and I think we'll be able to use some of the information that you share about your pediatric practice back to general dental practice. And the one that you raised there was finding out about the parents. And that my wife listens to phone calls of our clients.
Correct.
And hears the incoming phone calls. And so often we're treating a general dental practice that specializes in children. And so often at that practice, we hear the phone answered, and the parent says, "I need to make an appointment for my child," and they don't even ask the parent's name. They just say, "What's the child's name?" And yet the practice is a very successful practice, but they want to also start treating the parents because it's an untapped resource. These people are coming anyway. And how easy would it be to start a conversation with the parent about their dentistry if you actually knew their name, to say, "Oh, by the way, Jenny, when was the last time you went to your dentist?"
Correct.
You know that we're treating adults now here because it's like the vet. Remember, because vets clean teeth now of dogs,
Sure.
and we know that if the vet does a really good job on cleaning the dog's teeth, a lot of people bring their children down there because it's cheaper than taking them to the pediatric dentist.
And they for free. Yeah, that's right. It's cheaper, and their insurance may cover it. They have pet insurance.
Yeah.
Pet.
So, but it does. What you did there was with the parent is exactly bring the parent into the conversation, and in what we hear this often. When somebody rings up, they'll ask them, "Are you a patient here? I'm ringing to make an appointment for my brother. Are you a patient here?" And they go, "Yeah." And then where's the next question about who are you? When were you last in? No, back to talking about the brother. And we forget that there's another person there who has teeth and should be coming one of our patients, should be coming back to see us.
You're 1,000% correct. The irony is that people still don't do that. And I make my office, and probably like your office, and probably like many offices, but not as many as could be. We're exactly like the office of the television show Cheers. They want to go where everybody knows your name. I genuinely, care about my patients and the parents. And again, I know why you brought me your kid. Obviously, that's what I do. It's not going to be a surprise that he doesn't, he's got teeth and we're going to here to fix them. What a surprise. But if I don't know about you, one, we don't relate. Two, we don't understand each other. Your expectations, my expectations may be two different things. Three, I want to get a new friend. We still, again, I just had lunch with my old office manager from Scottsdale, and she just said, I just saw these three people, and we haven't practiced in 5 years there. We just saw these three people, and they ran up to me and gave me a hug. She goes, because I would rather my office manager get up and walk around the front of the desk and sit down and talk to the patients and not do her work. She'll get it done. She gets the work done, but I want her to do that. We had a patient, and we realized who we had. Well, I'll use one guy as an example. We had a guy who was on Medicaid, and unfortunately, a lot of Medicaid offices here do not treat people nicely. Some do, some don't. We did, and Oscar would come to this office, and Oscar was a huge guy, and we knew, and the first time he came here, he was crying as he said goodbye because he was never treated as nicely. He's always perpetually on a diet. So we would talk in our morning huddle, and some offices don't even have morning huddles, and whether you like them or don't, I think they're necessary, but totally irrelevant. We looked the night before, and I said, or someone said, oh, I see Oscar's coming. I'm going to bring the fruit in for Oscar tomorrow. So we said, okay, and I gave my assistant $5 who said, I'm going to bring the fruit. She goes to the store, she buys apples and oranges and plums or whatever she buys, and he walks in the office, and the first thing we do is say, hey, Oscar, how are you? Hey, kids. Hey, Oscar, how are you? Pat walks over and says, Oscar, which fruit do you want today? Do you want the apple, the peach, or the plum, or whatever it is? And he gets like choked up and appreciates that. With every kid comes two parents, and with every parent is attached a brain that really wants to be listened to, heard about, talked to, and have a fun experience. Another story, my wife teaches nursery school. This woman, I treat her 3 kids. Her husband's a pediatrician who refers me some patients. And my wife says, Amanda said to my wife, oh, I'm bringing the kids to Dr. Lee tomorrow. And my wife said, that's great. I hope they don't have any cavities. She goes, I don't really care about that. She goes, I'm sure that Lee does a great job at what he does. I love him and I love the office. I go for the coffee. Now we laugh about it because we had a Keurig machine at the time, and we didn't choose to use the Costco Newman's Own, and I get a box of 7,000. I only have that coffee. We go online every month, and we would order chocolate fudge, peanut butter brittle, tea, all kinds of flavors. So we all know that Amanda's coming in, and Amanda walks in at 8:05, for her appointment, and there's 3 cups of coffee or 3 types of coffee in the Keurig, and somebody says, whether it's me or somebody else says, hey, Amanda, which one do you want today? She goes, ooh, I'll take the chocolate fudge. And one of the staff says, well, I'll get it for you. She goes, no, I can get it. We said, no, go sit down, relax. Your kids are in the back. You don't have any time to relax. This is what we'll take care of you now. And I'm not beneath going to get coffee for somebody in the back room. I'm talking to a parent. I said, listen, while we're doing this stuff, can I get you a cup of coffee? No, I can get it. I said, no, I'm capable. I have 2 hands. I can do that. We're all part of the same team. And it's not in my office and all the experiences I have and on the lectures that I do and the offices that I consult in, you got to get past you're the doctor. That's like we said to you before. I'm not doctor. The only people that call me doctor were my parents who felt that they earned it, and they really did. The rest of it is Dr. Lee or just Lee. I don't want to be abused. I don't want to be mistaken for something that I'm not. But the bottom line is I want you to have a pleasant experience, and we're going to do that. And maybe my office is like the tortoise and the hare. I may not make $20 million, but I could make $20 million and make it for 6 months. But at the end of that 6 months, people are pissed off because I didn't treat them nicely. I'd rather do $1 million for 20 years. It's not that complicated. Yet people still don't understand that. People still don't understand that getting a cup of coffee or answering the phone, just like you said. I want to make an appointment for my brother. Well, who is this? Oh, it's Roz. Roz, how the kids? All that stuff. People think this is brilliant, and this is so far from brilliant, and it's nothing special. I still use charts. Okay, everybody has computers. I have computers. We're computerized. All my formal stuff is in the computer. My non-formal stuff and the quick notes that I put down is in my regular chart in case I have a problem or whatever. And I'm old and that's what it is. But I pull out the health form before the patient comes. I don't want to go on the computer and spend 20 minutes looking through the computer to find something. I pull out the health form and I see that Dr. Moffet is, I'm making this up, is a GI guy who specializes, whatever the wife said, and the wife is a teacher. I walk in and I'll say, hi, Joanne, what grade do you have this year? Or how's your husband? How's the GI business? And she goes, I can't believe you remembered. So my stupid answer is, well, of course I remember. My real answer is, I looked at the health form 2 seconds before I walked into the office. And I know most of them I remember because I'm pretty good at that. But people want to know that you know who they are. I'm watching some television show yesterday. This guy's been going, he's nuts. He's been going to a therapist. He walked in and she goes, who are you? He goes, I've been coming here for the last 4 months and you don't know who I am? I'm the guy that talked about the kid that was jumped off the building or whatever it is. She goes, oh, let me get your chart. Oh yeah, you're Chris. He walked out. You know, people want to know who they are. This is Cheers. This is a business, but it's also fun. And we got our patients involved once a year. You know, we did this for business purposes, but we also did it for fun. On Veterans Day, which is a big holiday here, we closed our office in the morning and we took our patients to the movies. And it was a patient appreciation day. And the ticket to get into the movie was you needed to bring food for the food bank, because Veterans Day is in November and Thanksgiving and the holidays are just starting and the people in the food banks need food. So all you had to do was bring a couple of cans of food and that was your ticket in. And it was fine. And the people loved going to the movie theater because, one, it was building a business and building a rapport, and they would also see their friends there. I didn't know that Dr. Moffet came to your office and he was there, or that Jane, that was my son's second grade teacher. How do you know her? They had a great time. And again, we fostered a bond between the parents and the staff and the doctors that work. I had 2 doctors that work with me. The 2 doctors that work with me, you know, they became friends. They became family. I just got invited to a graduation, you know, and the kids, I haven't seen the kid in like 10 years and they moved away. They said, we'd love you to come to the high school graduation. I couldn't go, but you know, that's what it's supposed to be about. You don't get that. No one teaches you that. No one also teaches you the paradigm shift, which is just really funny. I believe that we're trained in dental school to, as a pediatric dentist, I'm knocking on the door and I'm saying, Dr. Moffet, please send me your kids. I know you hate kids, but please send me your kids. And you who don't get a lot of kids may get 1 or 2, and maybe you tried them, maybe you didn't. And eventually you may send me 1 kid that is already a pain in the ass to begin with, excuse my language. And I don't want the kid either, but I'll take him because the buck stops with me. Instead of me knocking down the door on the general practitioner's office, why aren't you, Dr. Moffet, knocking down my door and saying, Dr. Lee, can you please send me the parents? And when the 5 or 6 people that I had that actually got it, because I politely, you know, said, what are you, idiots? You know, why if you send me a kid, even if you don't send me a kid, I can still send you the parents. And what I do when I send the parents is I match the parents up. I've got 10 doctors that I refer to, and I know, I'm making this up, I know you love glamping. So the doctor that I send it to, all 10 doctors are equally good. Equally good. They all range between a 7 and a 10. Everybody's going to go, you know, it depends on what you're doing. They're all good. So I'm going to send you, Dr. Moffet, to the 2 doctors that I know love glamping and camping or whatever it is. There's an instantaneous bond. You walk in and they know where they're coming from and they do the same thing that I do. And they're going to find out that you love camping. I don't care about your teeth. I'll fix your teeth. We're not here for your teeth. We are, but we're also here to figure out what the story is. So now you enjoy the conversation and you go back and you say to me, Dr. Lee, you sent me to Dr. Moffet, or Dr. Moffet sent me to this guy. He was unbelievable. As a matter of fact, we're going out for coffee next week because you bonded well and you'll do the work. And it translates into, sounds horrible, that doctor can do a filling 10 times for you and it'll fall out 9 times and you will blame yourself because he's such a nice guy. You can't believe that he would do crap. You can't go and say, I shouldn't have eaten that piece of white bread. That white bread was hard. I broke the tooth. And you're going to blame yourself. Now, the 10th time, you have every right to be annoyed, which is fine. You have every right to be annoyed. But doctors don't even get that paradigm shifted that I shouldn't be begging you. You should be begging me. You send me a kid for $300. I'm sending you a parent for $3,000 a piece. And that's worth a hell of a lot more than your $350 that you don't want to do anyway. So that's all odd. But the people that I refer to are people that I have vetted myself and would go to myself. I may not like you. I like you, but we may not have a lot in common, but you have the right skills and the verbal set of skills and the patient skills to do a good quality job on my parents. And that's what it is. And now that benefits me and it benefits you, doctor. Not only does it benefit the doctor that I sent you to, he comes back and says, this was great. And the parent goes, he sent me to the right doctor. And his next door neighbor says, oh, well, where do you go? I go to this doctor because this is Dr. Lee sent me over there. And I take my kids to Dr. Lee because he's amazing. And all these experiences are great. They all fall in to just thinking a little bit. This is not rocket science, in my opinion. And I'm not saying anything probably that most people haven't heard. Maybe I say it a little differently. Maybe I say it with a little humor. Maybe you say it one way, I say it. It's the same principle. If you don't treat people,
I want to tie a couple of things together there that you mentioned. You mentioned the morning huddle, and some people do them, some people don't. You did them, and then you mentioned the fact that you wanted to make sure that you knew the backstory of the parents when the parents brought their children in.
Absolutely.
And that's what I teach my clients. What we did, our morning huddle wasn't about how many matrix bands do we need, how many injections do we need. That already should be done. What I wanted to go through was to make sure that everybody in that office knew the backstory of every patient, so they could say, "Oh, you went to the movies last week when you were in. You said you were going to the movies. How was that movie that you saw? Gladiator or whatever it was. And to be on top of that game. And the trouble is that it's the long-term staff and usually the dentist first, and then the long-term staff who know the backstories of all these people. Like I can remember one lady, when Heather comes in, don't ask her about her husband because she'll burst into tears. He's been dead 7 years and she's missed him badly every day. You don't want to be doing that. But it's not, I've had to pull clients apart when they said, oh, this is how we do our huddles, and their huddles have got figures. And I said, why are you discussing yesterday's figures? The team that was in yesterday isn't in today. That makes no difference to the team that's in today.
They don't
what
care.
The team yesterday did, and you can't change it.
No, they won't change it. They won't. You can bring that. I talk about that all the time. And we had our morning huddles, and sometimes we did talk about that stuff. Or we could have had a great day, and I'll bring that up. But here's the health forms. That's how they know about Oscar. That's how they know about Amanda and the coffee, Oscar and his fruit. And the bottom line is, someone is assigned, it sounds silly, someone is assigned, we rotate around as a joke of the day. So today, David, it's your turn for the joke. Okay, and then we talk about, we have a tough day, we're going to be running, we'll go over schedule, we go over that stuff. It's 15, 20 minutes. It's for them to get their coffee, come in, smile, and bond with themselves. If they don't bond with themselves, if they don't like themselves, then they're certainly not going to like your staff. Your patients. And if they're not working together, it sounds stupid, but we had, I think this is funny. When you used to go to a hotel and you ring the little bell, it goes ding at the front desk. Okay. So when I would put topical in and I wait, maybe most people don't. Most people put the topical in and 30 seconds later, they take the topical out and they give the injection. Of course, it's going to hurt. If you read the directions, you're supposed to stay in there 2 to 4 minutes so that you're getting good topical anesthesia, and then you can give the injection. So the bell would ring. We had a timer, and timer would go, and the bell would ring, and they would ring the bell. The patient, because it was a kid, would ring the bell, and the staff, wherever they were, would go, order up, and whatever, because they thought it was funny, and then I knew that I had to go back into that room, because if I sat there, I would be like everybody else that takes the gauze out and not put it on a Q-tip, but take the gauze out and inject in 20 seconds. I have to walk away and I'll do something else. So they participated in the fun. They also participated. Now this may be stupid, and it's team building, and we did a lot of team building. And one of our team building exercises, or wasn't, I'm making this up. We had 12 staff. Doctors included, let's say we had 12 staff. We had a cooking contest, a bake-off every month one of the 12 of us had to bake something, put the recipe down, and they had to bake something. And they brought it in the morning huddle, or we had it at lunch or whatever it was. And then everybody voted on a separate piece of blank paper, and we put it in one envelope for that person. And we said, all right, what are you giving David's upside down pineapple cake? Okay. And it was independent. Everybody, I gave him a 7. I liked it. I didn't like it, whatever. Next month, someone else went. At the end of the 12 months, we ended up opening up those envelopes, taking the score. And it turns out that the upside down pineapple cake got out of 100, got 97. You win the prize. Here, everybody got the book of recipes. Everybody loved participating, and they tried to outdo each other. So your upside down pineapple cake next month could be, somebody's banana cream pie that has cream up here, and they made a cake that looked like a tooth. It didn't make a difference. They participated and they had fun. They got the recipes, and then they won like a $200 gift card to they didn't care about the gift card, although they did. They went to a nice steakhouse. We gave them a nice gift, but they participated. And it was that the first Wednesday of each month, whatever it is. That's part of the morning huddle. The morning huddle is not necessarily to tell me, well, we did $12,000 yesterday. I don't really care what we did yesterday. I'm glad we did it and we did well. Did everybody have a good time? Did we maximize pretty much what we were supposed to do? Did we answer the phone the right way? And I will answer the phone. People say, why are you answering the phone? Like it's at lunchtime. And I don't believe the phone should be empty. And one of the girls said, okay, can you answer the phone? I get the answer phone. Dr. Lee. And they say, why are you answering the phone? I said, well, we all work here together. I said, I politely said, I can't help you. But nevertheless, if you need to make an appointment, I can try, or I'll write it down, and then I'll have Pat call you back or whatever, just to confirm or whatever. Because the only time that person has set aside during the course of the day to make that appointment is at 12:05. And if no one answers the phone and you get a machine, they're not calling back for 2 weeks.
No, they're not.
I'm counting on that money for every 6 months. It's like my barber years ago finally got this. I suggested it. I said, why don't you do what we do with recall cards or whatever, however you want to do that. And you send me one if I don't make my appointment for my haircut once a month. And you send me a card and I know that I'm there, I will have 12 haircuts in 12 months. If I don't, or I call up and you're not there, I don't answer the phone or whatever it is, and I skip a month because I've skipped a month, now you got 10 haircuts in 12 months. You just lost 2 months worth of haircuts at $20 a piece or whatever. You lost that income that you didn't need to lose. So for me,
you still go monthly now, Lee?
What was that?
You still go monthly to get a haircut now?
No. I don't know. No, this is what happens when you have 3 girls, 1 wife, and 2 female dogs. It just disappears. I wear a lot of hats. But nevertheless, the point is still the same. And he finally started to send out cards. And he goes, you know what? He thanked me. 6 months later, he goes, I get more of my regulars coming back. It's like 6-month recall, There's just different things. You just need to extrapolate. You don't have to invent the wheel. Steal it from someplace. Or giving
you answers. That's a really good point there, Lee, because a lot of the stuff that I did in my office was experiences that I had in other non-dental industries, and I thought, well, that's working there. Let's see if we can adapt that into dentistry. So one of the ones that we did really well was the restaurant seating card. When you sit at a restaurant table, good restaurants will know who at that table is the regular, who's the guest, who's got the special occasion, who's got the special needs. And I thought, we can use that in the dental practice. Instead of having somebody walk to the door and call out, Mrs. Smith, let's find out where Mrs. Smith sits, which give each chair a number. Don't put the number on the chair, but we know the numbers. And we walk down the back and we say, hey, Mrs. Smith's sitting in chair number 4. She's arrived for her appointment with Dr. Moffet and she's wearing a red cardigan. So then when the dental assistant goes out, she walks straight up to the lady in the red cardigan and says, hi, Mrs. Smith. My name's Jenny. I'm working with Dr. Moffet today. How's your day been? And it's kind of like, hey, where's the call for the paddle boat? Yeah. It's gone. We've eliminated that.
You had that 1 minute of potential, make it a success or not make it a success. You walk out and go, Mrs. Smith, or I went into the hospital. This is even worse. Besides, it was a HIPAA violation. John Smith, your cancer results are back. You have cancer, but we'll see you in a couple of minutes. I said, are you kidding me? You missed that opportunity, like you just said, to say Mrs. Smith or Judy, whatever, however you announce it. After a while, the parents would all yell, "No, don't call me Mrs. That's my mother," or "Don't call me Mr. That's my father." Okay, whatever the casual callings you want to do. But how impressive does it look when you walk up and say Mrs. Smith in the red cardigan? They don't need to know. How impressive is it when I look at the health form and it said, okay, Judy's the teacher. She teaches 3rd grade at Anasazi Middle School, and this is where I can't believe you remembered that. I mean,
well, it's even easier now because dental software has photos of the patient, so you should be able to walk out there.
Well,
but
not everybody.
Lee,
Correct.
I was in the line at the post office, and it was a line between two aisles of stationery. And I was watching. I was just reading stuff on my phone. So when I got to the head of the line, the lady behind the counter goes, "Next waiting." So I walked up there, and then she had to go and get a parcel for me. So I turned around to see how many people were behind me. There was no one waiting. So why was I next waiting when I was the only person waiting? It was like, it should have been, "Yes, sir, can I help you?" Just something different. I looked around, next waiting?
Yeah.
And I've heard that in dental offices. I've heard somebody walk out. There's one person sitting in the client lounge, and they go, "Mrs. Smith, who's Mrs. Smith?" Well, there's only one woman there.
There's only one person here, unless you were the picture on the bulletin board in the post office, and that's a different story in the United States. Then you would be.
Yeah. Well,
You'd be the FBI.
I actually asked my post office. I said, "I'm trying to find the guy who was doing my fencing work who took off with some money of mine. Can I put a missing poster up on the post office, see if people can find him for me?" But anyway, you raise an interesting point about school teachers as well. My wife was a school teacher, and she ended up teaching kindergarten. She started off in year 6 and then worked her way down to kindergarten. And the only way that they could ever get out of teaching kindergarten was to go on maternity leave. Once they were assigned kindergarten, it was a life sentence. You're really good with small children,
right?
But so she left school to become a mother, and then when our children were old enough to find their own way home from school, I said to my wife, I said, "You need to come and be a concierge at my practice." I said, "We need somebody to schmooze the patients, and the girls have got their work to do." And so she was the. We were talking about English TV. Did you ever have Are You Being Served?
Of course.
It was an English. So
I
Captain Peacock.
Yeah, Mrs.
Yeah.
With her cat.
Mrs. Slocum. Yeah.
Her cat,
So Captain Peacock was the schmoozer. He would get people, help them. What do you want?
It doesn't mean that it doesn't have to be you. It has to be somebody. And I think your points are exactly correct. And it's not that complicated. Someone needs to be that person that steps up and be Mrs. Slocum, and someone needs to be, Colonel Peacock and whatever it is. And we all blend in together, and certain people have better strengths and some people than others, but we all work together, and we're all supposed to have fun together. So the points all together are you're 1,000% correct. I also think, I'm just changing the total subject. I think, and they think that I'm nuts. I wanted to go into a business, but I never did. There's something about, in the United States, there's something about somebody that has an Australian accent or an English accent. So I'm going to just use the English accent. When you get on the phone and you say, or at the end, how was it today? And the person goes, "Oh, it was lovely." And say, "Well, today is 107. You say, listen, can I give you more money?" The accent, it just sounds silly. We're used to the American accent, but I had a woman from England who was great. She sounds so much nicer on the machine if we were off hours. "Hello, you've reached the so and so and so and so," and it just sounds so much nicer and more classier and formal and whatever it is. And people used to laugh at that, but I think that if I was calling a German company, I would have somebody that speaks with a German accent, because it probably sells more stuff, because I expect my Mercedes, which is a German company, to have somebody German answering the phone. I don't know. It's a silly, stupid little thing. But it's also training the people how to answer the phone and do whatever. I just think that something with the accents just gets people. And I just saw somebody on the news that said, "I love your Australian accent," because it's just, there's something casual about it, but friendly about it, but warmth about it. And it seems that you're actually listening to me and caring. Besides, like, there's something about a New York accent. Unless you're from New York, you most people wouldn't tolerate that at all. You just know that that's a normal part of life. I when I would see people in the store and I thought, oh, I'm from New York or whatever, I would say, oh well, don't get offended, but how the hell are you? And sometimes I said a little bit. Oh, they said, oh, I feel at home because someone was cursing at them or whatever it was. So you have to know your audience and know your crowd. But everybody needs to walk in, and I think you're really funny when you say that, Mrs. Smith. Who else is here? It's only me. And I haven't changed my name. Pretend you know me. You can see people in the mall. How many times do you go in a mall or wherever it is, and it's a patient, but you don't know their name, and you go, hi.
Oh yeah, but you know what you did for them. Oh, you got a crown up on.
Correct, but you don't know who they are. Fine. My wife is already adept at saying, oh, hi, he's just an idiot. Don't pay attention to him. My name is June. Nice meeting you. And she goes, oh, I'm so sorry. I say, I'm so sorry. And the woman goes, my name is Harriet or whatever. I said, I'm so sorry, Harriet. Yeah, Harriet's the one I talked to you about, number 14, whatever. Oh, I know who you are. And that's it. Or Dr. Lee, I saw someone run down to me in the mall, and I just could not remember their name for a second. And June walked up and she goes, hi, I'm June. She goes, oh, I'm Julie. I said, of course. I said, Julie, I know Julie and her kids for the last 20 years. And so it works. We all help each other out. So pretend you know these people. This is not rocket sciences. My pearls of wisdom today are morning huddles for fun. Pearls of wisdom are, know your patients and talk about them in the morning. And so that everybody is comfortable. And if you serve coffee, don't have one brand of tea, have 20 brands of tea. So people will say, this is like going to a restaurant. People would stop in our office just to get a cup of coffee, which was fine. I wanted to give them a cup of coffee, and they would stay and they would talk to my manager for 5 minutes, and they would say, see you later. They felt comfortable enough to come into my office. We did special needs kids. I would say, come to my house. Because sometimes you couldn't get a special needs kid into your house, into your neighbor, whatever, until the kid knew me. So all right, so you come to my house, big deal. I think I told you before that I'm on the advisory board of a group based out of Jacksonville, Florida, that helps certify offices to become certified business offices for special needs kids. And what we do in part of that training is we're doing the same thing we're doing now. Is training the staff and the doctor, not as much as the doctor, but the staff on how to be compassionate, how to understand what that kid is, and what the issues are. We have cities. There's a little city outside of Phoenix, 10 minutes from down the road. The whole city is certified autism center. We work with that company works with the largest amusement park in the Middle East is in Dubai. And we work with them because they understand what customer service is, understand that they have a segment of population. They don't use the word special needs in Dubai. They use the word people with determination, which is a much better word, which encompasses everybody. So they want to be known as the friendliest country in the world, and they're pretty close. We're now doing something in Saudi Arabia, some city in Saudi Arabia that wants to be certified. That's not the point. You extrapolate that kind of thing. So that company happens to be great, and our staff was trained that way to be that. I had one woman in my office, and she was my special needs coordinator because she got her own card, and she was great at what she did. And the patients knew that that's what it is. If you have a population that's 85 and older, they have a hard time sometimes relating to the 17-year-old assistant. Maybe you take your 40-year-old assistant and you give them a little bit of ego building, and you say, you know what, you're closer in age to them. You can relate. They're as old as your mother. You understand your mother's problems with Alzheimer's or this or that. You can probably understand that. The 17-year-old has absolutely no clue that the Social Security check, they just lowered my Social Security check by $50. And the 17-year-old is like chewing gum. All right, what do you want me to do about it? At least someone who relates to that particular person. So maybe in a senior, in a general practice office, you assign certain assistants certain tasks. So when I had the special needs, Desiree did the special needs. She was the coordinator. Harriet would call and say, I got to bring in Brandon today. And Desiree would say, no problem. You know that Dr. Lee doesn't want to see Brandon. He only wants to see him between 10 and 12. She goes, yeah, I'm fine with that. What do you need? What else do you need? Do you have any new information for me about that? Oh, yeah. As a matter of fact, Medicaid now will pay for dogs, guide dogs or health, seeing eye dog, whatever it is. They'll pay for that. Thanks for the information. Not only was she doing her job, but she was also helping the patients. No brainer. It's not that complicated. And again, when I lecture to that stuff, and then people look at me like I'm from another planet, and I chuckle and say, okay. I think I told you my sister's a corporate coach, and she works with high end executives in big corporations like Northwestern University and Underwriters Laboratory, and they talk about training upper level management people to have that compassion, caring, and doing that. That's the doctor, and then bringing it down so the doctor can translate that down to the even the high school girl that files the charts, or whatever it is, the kid that works there. So it's all trickle down kind of thing. So the doctor has to take some initiative in a lot of points and say, hey, this is the way we're going to work. And if you don't like that, that's okay. And you know what? Quite honestly, if I have a good assistant and I pay her $25 an hour, and now I decide that she's so good she's going to leave, I'm going to pay her $30 an hour because she's too good to lose. All right, I will make less money, but I will be happier. I just had this conversation with the doctor the other day. He goes, I'm paying her $30 an hour. I said, you have less aggravation. He goes, absolutely. She shows up. We're friends. We go for a dinner once a month. She and her husband and her kids, she's become part of the family. It's worth the $5. She goes, that's one filling for me in the course of the day. And I'm willing to sacrifice that money for my own sanity in my office. And, obviously in everybody's office, you pay yourself last. I got to pay my staff. I got to pay my overhead. And then if there's any money left over, it's mine. Okay, great. But I want to make sure that my staff is happy. And that's why they didn't leave. I don't think that. So, and it's not money, because they can only make so much. And it comes a point where they can't get any more. But we can take you on. We're taking the afternoon off. We're going to the movies. I bring them in. I bring a pizza. We have a massage. It's not that big a deal. Or get their nails done. Whatever it is, they don't expect that. They don't get that almost any other place. So if they're treated with respect, then that translates into treating the patients with respect, whether it's the parents or the kids, and they all get invited to weddings. They get invited their friends. That's the name of the game.
It's all about relationships. Lee, now that you're retired from being a clinical specialist dentist, sounds like you're really busy with a lot of other projects. How do you find time? But one of the things that you're doing is that you're actually coaching dentists on how to have a successful business.
I'm giving it a shot.
How's that going? What are you seeing, and what problems are you helping those dentists with?
Well, a lot of the problems that I see are exactly what we talked about today, which is non-clinical. The clinical aspects, I can get into the clinical aspects. We can talk about that. And if we're really going to sit down and go, okay, it's fill your schedule, do all this, that. If you don't have the first component, which we just talked about today, then nothing else really matters. Again, it's the tortoise and the hare. You want to produce $10,000 a day and not be nice, you'll do that for 6 months and then you'll die. Or you can produce $1,000 a day for 6 years and be very happy and have fun and do whatever. If the officers that call me go over that stuff and don't understand that, I got to get that across before we even get into your schedules, before we even get into care. Before we even start talking about that group that I do with the advisory board with the autism, or another group I'm involved with teledentistry, which is now going to be everybody's doing teledentistry, and this company is going to be part of that field. And if you're not involving that in your office, we get into that. We get into more weeds, but we got to go with the overgeneral. The first lesson, if I could say, okay, I go to the store this is silly. I go to the store every Sunday. We buy cheap flowers that are $3.99 that last for 2 weeks. And all of a sudden the office looks nicer. It's silly. It's stupid. It's an overhead expense. but it's nice when the people walk in, and you got to gear your office to your people. If you're a general practitioner and you want to do kids and you don't have anything that's closely related to having a kid have a nice time in that office, whether it's a separate room, having a little chair and a table doesn't make it. The parents are only there because they don't know why they're there, you know, and or having a high-end practice. Okay, having a high-end practice with high-powered, let's say your office, you were in a business neighborhood, okay, and if you were smart, perhaps, and you had high-end business clients that came in, or business, you know, CEOs, whatever it is, perhaps you could have had an 8x10 room that was classified for your special needs CEOs. They walk in, Bob walks in, he's the CEO of I don't care, Amazon or whatever it is. And you say, Bob, why don't you go into the back room? You have a computer there, you have a phone there, you have the newspaper, you have the Australian Times, you have the Wall Street Journal, you have the television with the stock market on there. That room is geared for them. It's 8x10. They walk in there and you have a nice chair to sit on instead of the hard, silly chairs that you have. In my office, we have sofas and they face each other so that if someone is sitting there, they're not sitting in a plastic chair and surrounded by the outside of the perimeter of the office, and everybody just sits there and they're looking up at the television, or they're on their phones. I don't want them on their phones. You know, I want to be on your phone, be on your phone. You know, I want them talking to each other. Oh, where are you from? Or what are you doing? Or what are you? I had one patient that came in. Unfortunately, she had cancer, and it was she was great. And my other patient was a pain doctor, and specialized in what she had. And they happened to come in. It was towards the end of the day, and the bottom line is, I said, "Oh, I forget their names. So I'm going to say A and B. A, meet B. B, meet A. She takes care of what you have. You can ask her any question." And they stayed for like 2 hours. We were still finishing up, and finally I had to kick them out. And the woman who had the cancer was crying at the end because she goes, "Thank you for hooking me up with this person. You know, I now we bonded, and now she's gone to them." So that's all that stuff that seems to be extraneous that most people don't do. You know, whether you got a corporate coach in to help your team, or you do team building, or you do whatever, that comes down the line. Let's get the office up and running. Let's look at your forms. Let's see how you answer the phone. Your wife is the secret shopper. She answers the phone. They answer the phone. Hi, how are you? What do you want? Doesn't fly. You know, I need to know your name, or whatever it is. You know, and there's plenty of staffs. I don't have to do the 3 circles that tell you, oh, I'm a whatever they are. You know, I can't think of the words right now. You know, when you do your test. Oh, I'm a self-esteem person. Hi, and I'm a low. I don't care what you are. You know, I'm a pain in the ass because I got this wrong on this question. Okay, it's fine. It's that Venn diagram, and everybody does the Venn diagram to see where their team is, and they think that it's fun, and it's okay. It's fun to do, but it doesn't mean anything. You know, my staff can all be the same type of personality. We'll get them to get along, or they could be opposite.
The best Venn diagram is the Steve Miller Venn diagram. Have you ever seen that? You know, I'm a joker, I'm a smoker, I'm a real life
joker. Yeah.
It can be different. Yeah, you got to Google that.
Yes,
really good.
Well, I have my cousin was a real life joker. Never mind.
You raised a really good point about the skills that people need, and you're right. It's not they graduate with the clinical skills these days, and you know I've got a client. The associate is doing so many. He has so many changes to his schedule every day of cancellations and rebookings and failing to attend, and he's really missing some people skills. And I said, my client said, you know, what can we get him learn? How can we get him to learn people skills? And it comes back down to really two classics. Dale Carnegie, How to Win Friends and Influence People,
right,
and Robert Cialdini's Influence.
Mm-hmm.
You know, these books have got
they're great books.
130 years between the two of them,
yeah.
and they're you can't fault them. And if you read those, you will get better. But it is about people skills. You mentioned about referring adults back to specialists. One periodontist once said to me. A periodontist once said to me that he said, "You know how they say that people start to look like their dogs?" He said, "Well, what I find is that the referring dentist behaves like the patients they send you. If you get good patients, you've got a good referring dentist. You've got bad patients, ratty patients, they usually come from a ratty referring dentist.
Absolutely.
And so
Absolutely.
dentists have to work that out too. If you keep sending ratty patients to the specialist is not going to send you any adults back.
Right. Well,
He's
that's
going
why
to
I
send
think
you.
that you're a billion% correct. That's why I take that one step further. I take those 10 doctors that I have vetted that I like, and will send you. It could be a lousy patient, but you're going to like that patient better because you guys like camping together, and you'll have something that's relatable. So all of a sudden, that disarms the pain in the ass patient. And I will give you a warning. And say, listen, this patient's a pain in the ass, but you like camping. He loves camping. Talk about that. You win. Someone just told me the other day, all you have to do is talk to this one doctor about, I'm going to say football. As soon as you start, he's really on the spectrum of autism, and he's odd, but he only knows how to talk about sports. So if I have, I'm not going to send him Susie Homemaker because she's not going to talk about sports. I'll send that to somebody else. She might, but unless if she does, then I would have already said, you played lacrosse in college. He's a lacrosse nut, and you guys will figure it out, and that becomes a reflection on me. And you're right. That's one of the things we talk about. Who are your referrals? And first of all, why aren't you getting, why aren't the GPs coming and knocking on your door? Forget the specialist, but the GP should be knocking on your door. They don't understand that to begin with. So that's the first thing I say. Did you ever go to, who's the pediatric dentist? Hey, some guy down the street. I met him once or twice. He seems nice. Okay, well, that's a great way to bond. Do you think that I can send you my wife who needs 4 crowns and I who need 2 implants and a 3-unit bridge, and I'm going to send them over to you? You don't even know who I am. Why am I going to send them to you? I'm not, So maybe you should really take it the other way and come meet the pediatric dentist. It may not work that way for endo and may not work that way for perio. We can figure out a way. So when I sit there and talk about this stuff, and I talk, it takes a while to get to even to the nitty gritty of, it's dollars and cents. It's not dollars and cents.
Yeah, it's about relationships.
It is. It's all relationships. You do that well. I think I do that well. Whether it's the IBCCES or the autism or the teledentistry or anything else that works together that I may suggest. I'm not suggesting any of that stuff until you get your act together and figure out. And if you can't find good staff, then maybe we need to find that. And you know where you go find good staff. And I learned this, I'm going to say probably 1970. And it really made perfect sense. And everybody uses the example now. You go to Nordstrom's or you go to your high-end department store who works on commission but is trained to understand customers. So you can either go to that. My daughter, who works at a 6-star hotel, knows how to treat her customers. She walks down, she meets them, and she's a manager for leisure sales. She'll meet you, David, that was going down there, whether you have millions of dollars or you have no dollars. She's going to meet you and say, hi, David, or Dr. Moffet, whatever she's going to say. How are you? Let me take you on a tour of the hospital or the hotel. I'm going to take you on a tour of the hotel. Here's, and she meets them. She does it because she likes it. She's not doing it for a tip, but periodically she'll get a tip. Someone just gave her $700. $700 is a tip because she was nice to them. My daughter said, no, take it back. And they argued back and forth and they laughed and she said, okay, I'll take it. So she'll do that. So we don't even get past the nitty gritty until your office is sort of competent in relationships. I'm not going to change your design, but even a quick change in design, forget that. You walk in, I look at an office and say, you know what? There are people who you can go online and for $300 pay somebody who's an interior decorator to use what you have. Just by taking the chairs and rearranging the chairs and painting one wall, which costs you next to nothing, you have a new looking office. It's the same office, but you move things around and people, oh, it's new. I understand. I was at the doctor the other day. I understand we won World War II because I was reading the magazine there that said, Time magazine, that said, Allies, Japan gives up. Why don't you have current stuff? That's not that complicated. That's not that brilliant. whether you read it now, everybody. So if you want to do that, then have iPads for everybody. Funnel yourself into iPads. You can't sign up into the iPad until you funnel your SEO into that, and you have to sign up for that SEO or that website. So you use it. So now all of a sudden, and then when you post, I told you, that I post on 10 different dental sites for since COVID. I got 1,000 posts. My post for tomorrow happens to be one that's a fun post. It doesn't always have to be dental. All right, we're dentists, okay, but we're allowed to have some other personalities, and we're allowed to have some other stuff, and we can move from there. My post tomorrow is 10 fruits, talks about each fruit and how they got their name. Why an orange is called an orange, and it came before the color orange. Stupid, silly, it doesn't make a difference. That's just food for conversation. You want to give it out, you want to post it. You want to put a little thing on your desk. It's striking up a conversation, and when they want to see that you're human. I don't go on a website to look at a DO on number 29 and see the matrix band and the filling. And I hate the befores and afters. I understand you do the befores and the afters. They're going to do a before of me. This is me, and that's me after is you. Well, all of a sudden you got more hair. You redid your face. You put lipstick on, and you look beautiful. I want real people give me real testimonials, and that's what we had on my website. I want David to say, yeah, he did a great job with number 14, whatever it is. You can't see it, but I love going to the office. That's worth more to me than seeing a rubber dam on it. And it's also worth more to me if you take your blood pressure. I find that silly that most dental offices don't even do that. Someone say, oh, we do it. You don't do it. You want to be treated like a physician? You want to be treated like a real doctor? And I say that sarcastically. Then act like a real doctor. And you shouldn't be taking that kid or that adult that has a blood pressure of 240 over 180 and doing a cleaning today. Well, he's here already. Let's just do the cleaning. Well, send the body to die.
We could talk for hours, Lee, and you're right. We need to look at that total health, Lee. We've come to the end of today.
Yeah, I know. I'm sorry, David.
And I knew I was going to have to get the bell out or both people.
I didn't see the cut, but I got it.
But we've had good fun, and as always when we talk, and it's been really enjoyable, and you've really shared a lot of good information here for every dentist to apply in their office, and just go back and look at what they do, their processes, and make sure that they are ticking the boxes and getting people to respond as people and not as clinicians. There's a line in a movie where I'm just trying to think, the actor from Harry Met Sally's, what's his name?
Crystal.
Anyway, Billy Crystal, that's right. He says it's another movie he's in, and his ex-wife, he's broken up with his wife, and she's dating a dentist. The guy never even appears in the movie, and he says, "Oh, you're dating a dentist." He said, "Can I ask you a question? Does he play the same music at home as he plays in his office?"
Correct.
Correct. We're meant to be very boring. You and I have shown that you don't have to be boring to be a great dentist.
Well, that's why everybody. I'm going to give you my gratuitous plug. Need to come see you in Las Vegas because you.
Yeah, that'll be great. I think we're going to have
January, February. I forgot when you told.
It's February 28th. We're going to be doing that. Maybe 27th, 28th. Just depend on how many speakers we get.
Well,
but definitely,
that's the bottom line is you understand exactly where we're coming from. We're on the same page. I know we can talk for hours. We're on the same page, and most people don't get that real life experience. They're going to get the same lecturer that says, well, you got to look at your numbers. You have to have the schedule. You have to move people around. You got to do a 20-minute schedule. We're not even close to that. You haven't even gotten to step 1 yet. You do step 1, 2, 3, 4, and 5 before you get to the other steps, which are great. But if you don't do step 1, 2 to 5, like you're talking about or I'm talking about, it's worthless, my opinion.
Yeah. Lee, again, all the details, I'll put them on the end of this presentation. Thank you very much for being a guest today on the Ultimate Dental Podcast. It's been fun,
it has,
as always, talking with you. And Vegas is going to be something else in February.
That's it. And
it's going to be great. Lee Weinstein, thanks for being on the Ultimate Dental Podcast.
All right.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.